Welcome to our discussion. We have a kind of a fireplace discussion here. We're warming up around a nice fire, and I have some great guests that with whom I'd like to discuss a little bit what has happened in the last couple of days of this WSAVA Congress. So I would like everyone to introduce themselves, perhaps starting with Siraya.
Hello, everyone. My name is Siraya, and I'm coming from Bangkok, Thailand. I own a private practice in Thailand, and I thoroughly enjoyed this Congress from the start. Should I move on to say what I enjoyed about it, or should we just go around the table?
Let's just go around the table if you don't mind.
Yep, let's do that.
The next person would be Mary.
Hi, everyone. My name is Mary Marcondes. I'm talking from São Paulo, Brazil. I am a retired professor of small animal internal medicine, and at the moment I am the co-chair of the WSAVA Scientific Committee and a member of the WSAVA Vaccination Guidelines Group.
All right, thanks. And hi, Mary and Felisbina.
Hi, everyone. How are you? Well, I hope are very happy with the Congress we are having now in our computer. It's a virtual, fantastic experience. I'm Felisbina Queiroga. I'm from Portugal. I teach internal medicine and oncology at the University of Trás-os-Montes and Alto Douro in Portugal. And I'm also a member of the WSAVA Executive Board. And I'm very happy to be with you.
Fantastic. Yes. And Shannon, would you like to introduce yourself?
Thank you. Hi, everyone. My name is Shannon Thompson, and I'm an RVT from Ontario, Canada, and I'm the representative for the Registered Veterinary Technologists and Technicians of Canada. So I've had a great day moderating for the Congress, and I'm also with our representative on the WSAVA committee. So it's great to be here. Thanks for having us.
Great. And my name is Fred Gaschen. I'm with Mary, the co-chair of the scientific committee, and yes, we were both quite involved in getting the program together. When I'm not with WSAVA, I work at Louisiana State University as a professor of small animal internal medicine. So that's it for the introduction or the introductions. Who would like to give their first impressions? Like Shannon, can we start with you? Like since you're the last one who introduced herself, what were the cool things that you've heard about in the last couple of days?
Well, Fred, I think that one of the best things is that the Congress is you get out of it what you put into it, and everything is there for you, and it's so easy to access. And whether your time zone fits or not, it's you can still see on demand if you can't get into the schedule. I know some of them are really early in the morning for us. But I really enjoyed the diversity. There's a whole track for veterinary nurses and technicians, which we're always so grateful to see. As much as we like to participate with the other scientific sessions, some of them that are a little more tailored to the veterinary nurse and technicians is great. That today I was with Ed Carlson in nutrition and Ed Durham for cardiology. Some amazing speakers and amazing information. I loved seeing the topics earlier for artificial intelligence for veterinary medicine. I think that's really interesting. And telemedicine, hearing how it's coming across the world. COVID has really accelerated that. So it's really interesting to see and hear from other parts of the country. And then Megan Brashear speaking about thriving, not just surviving in veterinary medicine. And I think that's really a global topic, and I think it's really important that we talk about it. And so these are some of the real points that I'm really interested in. Some I have to go back and see because I wasn't up at 3 a.m., but I'm eager to see them.
Well, thanks. Yes, thanks for sharing. How about Felisbina? What were your takeaways?
Well, I have been enjoying a lot all the sessions, but the thing that I want to highlight for now is that I'm not anxious when I select one lecture because I know that I will have plenty of time to see all the lectures. So this makes a difference in my mind. I can select today and see what I want, or I'm moderating, but I know that I'm not losing any kind of information because tomorrow I can go and see on demand whatever I want. So I think this is very important for our audience.
Right. So there's no horrible and impossible choice to make. You know, you can. You've said it very well, and that's a big advantage. Some other people you could list, disadvantages such as, well, we are in 5 different places of the world, and we could be together enjoying our favorite adult beverage, but we're not. But however, we have access to these lectures for 3 months, really. So there's not even a lot of time pressure, and that's going to be fantastic, right? So, Mary, what were your takeaways there? What did you like in these first 2 days of the Congress?
Well, the Congress is fantastic, in my opinion. Yeah, we have amazing speakers, excellent lectures, discussions. It was really difficult to choose just one lecture, especially today when I was not moderating. But the nice thing is that the lectures are recorded, as everyone just mentioned, and we can go back and watch them anytime. Yesterday, I was moderating and watching the WSAVA practice Pearl session, and they were fantastic. But there is one that particularly caught my attention. I don't know if you had the opportunity to watch, but it was from Dr. Maureen McMichael. And she was talking about anti-aging techniques for geriatric patients. Seriously, as soon as she ended her lecture, I've decided to change my life. I need an appointment with a geriatrician. I will start to take melatonin every night. I will start to do intermittent fasting. It was so interesting. It was all of them were really nice, but this one particularly caught my attention, and I want to watch it again to see if I can learn more things to not get so old quickly. And today I watched the derm lectures given by Dr. Chiara Nolli in the morning. They were absolutely fantastic. Anyone that works on small animal internal medicine should watch them. And in the afternoon, I kept in and out on One Health session and the oncology working group lectures. Dr. Yola and Dr. Ann gave fantastic lectures on biopsy, cytology, and histology. And they also presented some clinical case discussions. And regarding the One Health session, Dr. Sarah Cleveland talked about pet association rabies, the current situation, how we will manage to end canine rabies by 2030. And I was just watching now Dr. Simpson's lecture about bacterial gastrointestinal diseases and Dr. Manchester's lecture on chronic intestinal diseases. So far, I loved all the lectures that I've watched. And I'm looking forward to access the other ones that will be online soon.
Yeah, you made me. I hadn't seen many of the lectures you mentioned, but I look forward to seeing them. And so, what we've heard so far is it's really a testament to our speakers. They do a fantastic job. I think we wouldn't be able to put anything together without the goodwill of all our speakers and their readiness to share their expertise, their wisdom, and all that. So, we have a fantastic crop of speakers. That's for sure. We're very lucky in that respect. So I made some notes of all these good talks that I need to go and listen to in the coming weeks or so. Hey, Siraya, what about you?
Oh, I had such an amazing time yesterday. All day I was moderating in one stream that I knew very little about, but I was so interested about before. And that was about brachycephalics and BOAS, which is the syndrome that we often associate with this
Right.
these dogs. But however, in that entire stream, I found out so many other health-related issues and things that are totally not taken into account. People aren't aware of it. What I found in this entire stream that made me very excited, and I wanted other people to hear about it too, and yes, I am biased because I did moderate it. However, the fact that it's not just science, but it's our position in what we could do for advocacy of these animals, how we can make animals actually live healthier lives, not just keep on fixing their problems, but being a part of not making their lives be created in this way. And I find that it was amazing lineup of speakers. But in saying that, it made me not able to attend at the same time the telemedicine panel discussion, which was very timely and very interesting. So I made a note that I'm going to go back and listen to that. This makes my life so much easier and nothing to choose. And the speaker of the year is the one lecture I want to go and listen to, Dr. Elsa Beltran. Nobody should miss that one. That would be something so wonderful. Oh, but at the same time, I think that there is another awards lecture by Dr. Claudia Roche. And I'm so impressed with her because she is, as you had mentioned before, Fred, is the first woman to receive this prestigious award. And I'm so happy that she's going to be the start of a long string of so many other female high achievers.
For sure,
so
for sure.
We must listen.
She's fantastic, and she got the award for many good reasons. And I haven't seen her lecture because I was moderating another stream, but I can't. I mean, it's on my calendar to go and listen to it. Yeah. So. Well, thanks for all these for making all these comments. I listened yesterday to Elsa Beltran, and I can absolutely recommend to everyone to listen to her talk on localization of neurologic lesions, spinal lesions in particular. And she, as usual, did a fantastic job. She got the Speaker of the Year at our last Congress. It was not just random. It was certainly well-deserved. This afternoon, I was up to my neck into gastroenterology. I was about to say almost into poop, but that's not quite true. We talked a little bit about fecal microbiota transplantation. That was an interesting part. But I want to say of the whole afternoon, Dr. Steiner, who is a very well-known specialist, talked about canine pancreatitis and feline pancreatitis. He presented the consensus statement that he had been a part of on diagnosis and management of feline pancreatitis. And he presented a very attractive, very interesting lecture on acute pancreatitis in dogs with some really interesting outlook on new drugs out there that prevent migration of neutrophils and could be used in the next few years if they are approved in your country, which I hope they will be. Currently only approved in Japan, could become an integral part of our treatment for pancreatitis and hopefully increase the odds of success for that treatment. So that's really was for me the novelty that was very interesting and hopefully soon practically applicable. Yes, so lots of stuff happening. Clearly, I can't wait to go see the brachycephalic session that you mentioned. And Felisbina was going to say something.
Yes, myself and Shannon, we also want to talk about the things we love to.
Yes, of course. Go ahead.
Well, I was hearing you, and during I was most of the moderation, and from the lectures I saw, I want to highlight the one from Dr. Stefano Comasi about laboratorial approach to an oncological patient. It was a very good lecture, and all the morning today with the Dr. Mami Irimajiri about behavioral problems in cats and dogs. I really recommend you go and see. And the last one of the morning, it was about is this a behavior disorder or not? Tips for differential diagnosis. And this is very practice. It's a very good lecture. I strongly recommend. And well, I also recommend the practice pearls. Yesterday and today, in half an hour, speakers talk about relevant issues are vaccination, ehrlichiosis, leptospirosis, and others that were already mentioned. And in 30 minutes, our colleagues can get a summary with the most relevant things to see and to reminder. And for the last, and maybe, well, due to my special interest in oncology, I would like to recommend the lectures that the oncology working group has done for WSAVA. And this afternoon, they talked about biopsy, guidelines for biopsy and adrenal tumors, clinical management, and also surgery approach. But there are more for tomorrow. So
for tomorrow, right.
So many good things to see and to learn.
Yeah. Shannon, you want to add something?
I do. I really do. And I want to, this is a kudos and a shout out to WSAVA for making this available at such a reasonable rate, especially for, I'm going to shout out for technicians, for veterinary technicians, RVTs, and nurses out there. It's sometimes difficult and fiscally challenging to travel to these large conferences and where these world-class speakers are. And the rate you guys have for this conference is phenomenal. Really want to thank you for that. And it's not just for the attendees, there's really exceptional rates there. And so I'd like to, if I'm correct in saying, Fred, they can still register if they haven't registered yet. Is that true?
Right. Yes,
that's right.
Absolutely.
So
yeah,
you can still register because we still have another full day, and not to mention all of these sessions you can see on demand. It is amazing. Not these you won't get these opportunities to see these speakers and these topics again necessarily, or in such an opportunity. So I really encourage everybody to take the plunge. If you haven't done it yet, register and really have a chance to sit down at your convenience to see these. And thank you to WSAVA for making it available for everybody.
Fantastic. We'll give.
I have something to say.
To our president, Siraya. Yes.
I'm very excited as well, Shannon, and I just wanted to second what you just said. Also to add that the rate for students is also so affordable, and wherever you are, you guys know what to do. Now next year, we're all looking that, okay, there's the pandemic's going to be lifted, people can travel, we can do face-to-face. But what I would like to say is that if there's any virtual congress that you would be going to, this is the ultimate one. Keep this in your pocket. Then you go to your face-to-face next year, but this is the one. Do not miss. Still
this
have
is
time.
The one.
It's the one.
Right.
Thank you.
Right, and there is still a lot to look forward to tomorrow. I guess there are several WSAVA committees speaking, reproduction, animal welfare and wellness, oncology working group. There is some ophthalmology, infectious diseases, surgery, to name just a few. So check the program online, but it's not done yet. And again, you can go back and listen to all these lectures that we just mentioned. I want to thank everyone for taking the time to participate in the discussion. Thank you to those who listened to us. Hopefully, those who are not here are also have also enjoyed the last couple of days and will enjoy the last day tomorrow. So this being said, Have a nice rest of your Sunday, and I hope to see many attending tomorrow. Okay, that's a wrap.
Thank you.
Bye-bye,
Bye-bye.
everyone.
Bye. Thank you.
Bye-bye.